I trained as a paediatric nurse, and after several years working in paediatric intensive care, I had the opportunity to undertake some training in transformation skills and how to come alongside colleagues looking at performance improvement. I was then able to apply the digital sphere to my role, where I was looking at acuity scoring and rolled out a system across the children's hospital that I was working at so that we were able to measure essentially the impact of acuity against staffing levels. This then led into further transformation roles, getting experience of working alongside colleagues on complex change projects. And eventually I came into conversation and by networking with some people at Cerner, and a position opened up there as a clinical consultant. And with my experience, I applied for the role and I was successful. During that time, I was involved in a number of deployments of electronic patient record systems. And then in 2018, I moved into an executive role where my responsibilities are about driving transformation and working alongside leaders such as CNIOs, CCIOs to understand the requirements that they have and how the solutions and the systems that we deploy at Cerner can come along and match the needs that are required to support safe delivery of care to patients. There are a number of pathways open to nurses who want to work in the digital ecosystem. Essentially, there is no official qualification for working in digital, but my experience and my advice to others would be that it's important to be able to get experience in change management. Something to go alongside that, you might want to do a course such as I did in a quality improvement technique such as Lean Six Sigma. Just in the last 2 years, I have been undertaking a master's degree in health informatics. And whilst, again, this is not a mandatory requirement to work in the digital sphere, I'm able to understand more of the theory around digital and then apply that to my vast experience that I've got, which means that then I'm really closing the gap in terms of the value and the benefit that I can bring to clients and to my workplace and to all those that I work with in digital health. The key responsibilities that I'm responsible for in my role, firstly, is about coming alongside digital clinical leaders such as the CCIO or CNIO and working with them to really understand the requirements of their organization and the care delivery that they're undertaking to support them in putting into place the correct digital systems that will support care delivery. Other elements of my role include strategic planning with clients and also internally at Cerner as well. We want to make sure that we're road mapping our digital solutions and driving value on care delivery. I'm one of the clinical safety officers at Cerner, helping to provide oversight of our clinical risk management system. That also means coming alongside our clients in supporting them in them meeting the requirements of clinical risk management as outlined by the NHS. One of the other important aspects of my role is collaborating and working in partnership with other stakeholders and professional bodies in the wider ecosystem of digital health. It's really important that we're providing leadership and influencing health IT policy so that we're making sure that it's aligning to improving the outcomes of patient care. What I bring to the role professionally is my clinical experience, my credibility of still being a frontline nurse, but also I bring my compassion and my empathy, something that's very natural to us as nurses, but really important that when we're coming to work alongside users of digital technology, that we can understand their frustrations, their requirements, and their hopes that we're bringing value to the role. What I really enjoy about my role is working with people. I work in a fantastic team at Cerner. I work with fabulous clients. And whilst technology is important, what's even more important in digital transformation is working with the people and building those relationships. So if you're interested in being involved in digital transformation, my two pieces of advice would be, Firstly, why not get involved with our eHealth forum at the Royal College of Nursing? And secondly, just go and get involved in a local project wherever you're working, be it a hospital or in the private sector. There's always digital transformation projects happening somewhere in this day and age. Go and get involved, get some experience. That's a great start.